Hello, I'm Tricia Kirkland. I'm the counselor at Ben Lippen School, and we're here today to talk to Bert Medlin, who's a licensed professional counselor, on the topic of anxiety and depression in adolescents. Bert, thanks for coming today. Can you tell us a little bit about yourself and what you do?
Sure, thanks, Tricia. I am a licensed professional counselor at the First Presbyterian Church Counseling Center in downtown Columbia. I've been doing counseling for about 15 years, and I do a lot of counseling with children, adolescents, their parents. I really have a heart for helping youth and to make sure that they are healthy and that they can function in today's world.
Well, thank you for being here. How frequently do you feel like adolescents are struggling with anxiety and depression nowadays?
Yeah, so that's a good question. The National Institute of Mental Health has produced some statistics, and they say as far as depression is concerned, a little over 12% of youth between the age of 12 and 17 will be struggling with full-blown depression and to have a full depressive episode. And, for a child for it to be that many people, 12%, you're saying out of 100 kids, 12 kids are going to have depression sometime between the age of 12 and 17.
Yeah.
Anxiety is a little different. The statistic is, and it's a little bit different because where anxiety, it's not just one anxiety disorder. There's several anxiety disorders. There's obsessive compulsive disorder. There's generalized anxiety. There's people who have panic attacks, phobias, whatever the case may be. Even post-traumatic stress disorder is under anxiety. But their statistics shows over 31% of youth between 12 and 17 will experience some form of an anxiety disorder during that time frame, and that number is astronomical.
Yeah. When do the symptoms usually begin first appearing?
Yeah, because of my profession, I see it at various stages, but typically around middle school is usually when I see some of the symptoms appear. It can be as early as 7, 8, 9 years old, and it could be even after middle school, even getting into their high school years. But typically the stress involved with middle school and developing friendships and everything that goes along with middle school typically triggers some of the anxiety and depression that I end up seeing in my office.
I want to take some time to talk about anxiety and depression separately. So let's first begin with taking a closer look at anxiety. What are you seeing are the causes of anxiety in the youth?
Good. Great question. And when I talk about this, there's a principle that is used by a lot of professionals, and that principle is genetics loads the gun and the environment pulls the trigger. And so when you talk about what are the causes, it's not necessarily if the person's family has a history of anxiety or depression that they are absolutely going to have anxiety or depression. That's not the case. But if the environment is set up in a way that it creates enough stress, if there is a family predisposition, then the genetics loads the gun and environment pulls the trigger. And so if you have somebody, and I see this quite a bit, if you have a mother or father who has several generations of parents who struggle with depression, and then you have a child that comes in and they've been experiencing a lot of stress in school, a lot of stress relationally, and all of a sudden they start displaying some symptoms. Genetics loads the gun, environment pulls the trigger. But some of the other causes can be trauma. Any child that's going to experience any type of trauma, physical abuse or any other type of trauma, even something as simple as a car wreck. I've seen children come in with all types of anxiety disorders, trouble sleeping, and it can also be things related to a decrease in coping skills. If teenagers are losing coping skills and they don't have coping skills for what we call stress resiliency, and stress resiliency is the ability to be able to absorb stress and shed it without taking it on so personally. And I think more and more teenagers these days, they need those skills, or that's going to be one of the causes as well.
I also wanted to talk to you about how will parents know when their child moves from being in a situation when they're experiencing just a normal stress of adolescence versus this is something more significant and they need to go and get professional help. How do they know?
Yeah, absolutely. Every parent comes and asks me that same question because it is normal for teenagers to experience some level of distress, whether it's a test that they have, whether it's difficulty in relationships, whatever the case may be. Kids experience difficult times. They are going to have multiple tests on one day and feel overwhelmed. But a day or two later, that has passed. It is circumstantial, and then it's passed by, and they're feeling better. They've come out of it. But when you have a person who has an anxiety disorder that really needs attention, it is a child who is experiencing high levels of stress that is really starting to cause them to have a lack of functioning. And that lack of functioning can be something due to not being able to sleep, not being able to eat. A high symptom that I oftentimes see referred to me is because children feel sick to their stomach. And pediatricians refer them to me because they've ruled out any type of acid reflux. And so it can be any of those things that creates the problem.
Okay. Bert, I'd like to turn our attention to talk about depression, which you've mentioned is something that is what our teens are dealing with. What do you see as being causal factors for depression in adolescents?
Yeah, it's very similar to what we answered earlier about anxiety in terms of genetics that a person may have, and also the environment and what happens around a person's life and the level of stressors that they have. And so the phrase that we used before is genetics loads the gun and the environment pulls the trigger when you're talking about a depressive disorder. And so if you have a child whose family has a history of being depressed and even anxiety, as we talked about earlier, then it can create a predisposition for having a depressive disorder. It does not mean that they're going to have a depressive disorder. But if there is a certain level of stressors, if there's any type of traumatic event that occurs in that person's life, and whether it be something that happens to their family, it can even be something as simple as divorce or complex as divorce. It can be something like a tragic, traumatic event that occurs in a person's life. All of these things are factors that goes in to be what potentially causes a depressive disorder.
So along the same lines we asked for anxiety, a parent has a child. They've been blue, they've cried a good bit, maybe they're withdrawn. When does this parent know this is beyond what is quote-unquote normal versus, oh, I really need to take my child in to be assessed if this is something major?
This is a common question as well because every child is going to feel a little bit down. Every child is going to sleep in a little bit longer than they normally do. But you really want to ask yourself, how long is this lasting over a period of time? Looking for particular symptoms. Is this child starting to talk about things that they feel worthless over a period of time? Are they starting to talk about feeling hopeless in life? And this is more than just having one day where they feel like nobody wants to be my friend. This is something more where days turn into longer, into a week, where they're talking about these things. They have a loss of energy. They stop enjoying the things that they once did before. They may be sleeping longer than they slept before. They may have trouble eating to some degree or another. And all these things compound in. And one of the most telling signs is if a child is starting to talk about thoughts of ending their life. And that is one of the most serious things that we need to look at. And so if a child is talking about that, then that needs to be addressed.
That actually leads into my next question is what should a parent do if they discover that their child is suicidal, or maybe their child tells them that they have a friend that's suicidal. How's a parent supposed to respond to that?
Yeah, I can't. If you're getting that as a parent, that is a very difficult situation to have your child talking about wanting to hurt themselves. And so we want to take that very seriously. And first, I encourage parents to sit down with their child in a distraction-free environment and be able to talk to that child and to ask some questions and really find out what's going on in a non-judgmental way. You don't want to come across and as a parent telling your child to just suck it up, but you want them to be able to open up to you and share what's going on. As well as that, you want to be able to find out how serious is this, how serious is their thought of hurting themselves. Because many teenagers may say something like, well, I've oftentimes wondered what would happen if I died. Would anybody miss me? But that's a lot different than a child who is having an ongoing thought process of, I wish I were dead because life is too tough. And so I oftentimes discuss with parents talking to your children about a scale of 1 to 10 and asking your child on a scale of 1 to 10, with 1 being not at all, you're not having any thoughts about ending your life, and 10 being, when we get done talking, how likely are you going to try to end your life? And the higher that child is, from a 5 up, the more we have to do something as parents to make sure we are getting that child safety. And I talk to parents about the similarities between pulling a fire alarm in a hotel and a child saying that they want to end their life. If you pull a fire alarm in a hotel, they have to call the fire trucks. You can't say, well, it was an accident, I didn't really mean it. We've got to call the fire trucks because they have to come check to see if there was really a fire. And it's the same thing with thoughts about ending their life. We've got to get that child some professional help to make sure that there is not a fire that's going to hurt that child for the rest of their life. And as far as what if they have a friend, I tell parents, if your child tells you they have a friend that is actively talking about wanting to end their life, that you as a parent would contact that child's parents right away and to let them know and to be able to seek out any type of help with the school or whatever they need to make sure that those parents are aware. Because oftentimes these days children are saying, please don't tell anybody. And we cannot keep that a secret.
Thank you. Agreed. I'm glad that you went through all of that. So we want to help equip parents to know how to get help. Okay, whether it's for anxiety, depression, or something as severe as concerns of suicide. How would a person go about getting help? For example, do they go to the doctor? Do they go to a counselor? What's the difference between Christian counseling versus secular counseling? If you could help our parents out in this way, I think we'd be very appreciative of that.
Sure, absolutely. Yeah, so sending your child to a professional counselor is someone that's going to be able to assess your child to determine what is actually going on, to give them figure out what is actually happening. Is this depression? Is this anxiety? Is this something else? And so seeking out a counselor to be able to help your child to diagnose the problem and to come up with the correct solution and the correct treatment plan is paramount. And as far as seeing a doctor, it is fine. Oftentimes, I will recommend that they send the child to the doctor to do some blood work and make sure that everything is okay. And under circumstances where if a child has depression or anxiety that's severe enough that they are not functioning in school or not functioning at home or not functioning with their friends or family, that sometimes they need a medication evaluation and a doctor is necessary. But as far as the Christian counseling is concerned, we at the First Pres Church Counseling Center, it's also called the Christian Counseling Center, we really believe in using God's Word and bringing in Christian principles to be able to help our children. I think God's Word is more powerful than anything I have to say. And as I have worked with hundreds of children and teenagers, I have seen God's Word be able to transform them and to be able to bring healing and wholeness that I could have never imagined at the beginning of our sessions. But as far as getting help, they can look up the counseling center. They can look up, they can ask their friends, do they know of any counselors that may need to help them? They can ask you or Shannon Glenn for a referral. And somewhere along those lines, we want to find a way to get that child help.
Yeah. Thank you. We have a list of counseling centers that are in our area that have counselors that love the Lord, and they're also professional, and it's great to have those resources here in Columbia. Bert, thank you for coming today. Thank you
You're
for
very
answering these
welcome.
questions. We appreciate it, and we know that we're all wanting to help our kids. It's a hard time to grow up, and we appreciate everything you've had to say.
Absolutely. Thank you.
Thanks.